Hey mama, are you feeling overwhelmed by the kind of recovery you might face after a cesarean birth? First of all, you're not alone, but you also don't have to stay in a place of overwhelm and uncertainty. In this video, which is just one video taken from the whole Built to Birth Part 2 online course about the postpartum period, you will learn the basics of what to expect after a cesarean birth and how to be an active part in your own recovery. So let's get started. If you've had a cesarean birth, your recovery, I would say, is even more important to prioritize because you have just gone through major abdominal surgery in order to birth your baby safely and healthily. In general, women who have vaginal births have the most work during labor and an easier recovery, while women who have planned cesarean births may have an easier labor because they sort of skip over that laboring period, but a more challenging recovery period. Often though, for first-time C-sections, it was unplanned, which means mama experienced labor up until some point in the labor before giving birth via C-section. And when that is the case, and a C-section was unexpected and unplanned, mama hasn't been able to prepare for what to expect during recovery. No matter what has led you to a cesarean birth, our session together now is going to give you several tips, tools, and insights into what to expect after a C-section and what you can do to give your body the best healing period. The first thing that you can expect after a cesarean birth is bleeding. That lochia, which is the discharge that your uterus is expelling after birth, is still going to be there, although typically it's less than after a vaginal birth. The first few days it will be a bright or deep red color, and after several days it will become less and less and change into more of a brown color until eventually you only have light spotting or a yellowish discharge by around 4 to 6 weeks after birth. You'll want to make sure that you're wearing large organic cotton pads or adult diapers for the heavy flow days at the beginning of your postpartum period, but as you notice the flow diminishing, you can move to thinner pads. Never use a tampon during postpartum recovery because it can increase your risk for infection. Now, if your labor ended up in an unplanned C-section, you may experience a sore vaginal area as well, especially if you ended up pushing before needing to give birth by a C-section. So you may experience some swelling and tenderness, and this is very normal and should go away in the first few days following birth. Even if you did not experience labor before your C-section, swelling and tenderness is normal because for the C-section, a catheter was inserted into the urethra, which is the pee hole, so that pee is automatically being removed from your bladder, and that isn't removed till several hours after birth. After it's removed, it's common for there to be some discomfort, swelling, and kind of a weird sensation when you go pee for the first few times. You can use a peri bottle, which you will take home with you from the hospital, or can buy your own, which is a little fancier and easier to use than the ones from the hospital, through my products page, which is linked in the notes section. You'll fill your peri bottle with warm water to avoid needing to wipe after using the bathroom to help avoid those weird sensations or the discomfort that can be present after birth in that vaginal area. After a C-section, you're generally going to pay most attention to your incision on your abdomen. Typically, it's going to be a horizontal incision that lies very low beneath your belly button, but in rare situations, it will be an up and down incision, but that method of surgery is very, very rarely used. Most of the discomfort that needs to be healed is going to be from that incision. You'll notice swelling on your tummy, and that is your body's natural way of creating more blood circulation to aid in the healing process. Now, for the most part, you don't want to mess with your incision site. After your C-section, your care provider will take a look to make sure that it is healing so far, and typically you'll be in the hospital between 2 to 4 days after birth, and your team of nurses and doctors are going to be making sure that healing is going well. If you've gotten staples, your doctor will remove them while you're still at the hospital, and your skin will have already started to fuse back together. If you've received stitches, they will start dissolving on their own, or sometimes they will need to be removed by your doctor. A lot of times you'll have a very strong kind of medical tape that helps cinch the incision closed, and you don't want to try removing them on your own because it can damage your incision site if irritated too soon. Now, after birth, it's going to take a few hours for you to feel ready to move around, but between around 6 to 12 hours, your care team is going to make sure that you're slowly starting to regain your mobility. As soon as you get clearance from your doctor and you have the energy and strength to move around, that is something that you should do. Moving around increases circulation to help prevent blood clotting. It's going to help with a faster healing and recovery period, and it's going to help your bowels to start moving again. Now, when I say moving, I don't mean walking around your entire hospital floor. Walking to the bathroom, standing up to gently stretch, even just sitting on the edge of your bed to dangle your feet are all ways to start mobilizing your body to help with the healing process after a C-section. At the same time, you don't want to overdo it, so listen to your body and rest when you need to, but also balance your rest with movement. Now, I said that walking around can help get your bowels moving, and that is a very important part of cesarean recovery. Because of the epidural or spinal block that was placed to numb the sensations of the surgery and the drugs that you'll be taking after the C-section for the pain, constipation or trapped gas is very common, and before you leave the hospital, your care team is going to make sure that you can pass gas and go poop. So being mobile is going to help with that, as well as taking stool softeners that your care provider gives you, drinking lots of fluids, and trying to incorporate fibrous foods into your diet even while you're at the hospital. And those are all things that you're going to want to continue doing when you get home to help avoid really uncomfortable constipation or trapped gas. This is also going to save you from the discomfort of bearing down when you go poop and the pressure put on your incision. When you do use the restroom, keep in mind that bending down can be pretty uncomfortable at first, and thankfully, toilets at the hospital are taller than the ones that are in normal households. But one product that can really help is a toilet seat riser, which you can get through the link to my products page, and a footstool that helps you be in a squatting position as you go number 2, which is going to help going a lot easier and avoid getting backed up and putting pressure on that incision. Now, to help with healing your incision, there are a few things you can do. The first is to keep it clean. Baths aren't recommended right after a C-section, but showers are generally fine. Your doctor will let you know what you can be doing to help with the healing process, but in general, when it comes to showering, all you need to do is shower normally, possibly wash the incision gently with soap and water, but clear that with your care provider first, and then pat it dry with a towel after. You want to keep it clean and dry as much as you can. Using a warm rice pack on the incision is going to also provide a lot more comfort as well, and can help with feeling secure when you need to cough or sneeze. You can use an electric heating pad, but because the rice or flaxseed ones are a bit weightier, it actually provides more comfort than just the electric heating pads. You can make your own rice or flaxseed heating pad for the microwave, and I have the instructions for you to read and go over and follow in your workbook, or you can buy an electric heating pad or a rice pack through my product list on my website. This brings me to the next thing that you can do to help with the healing process, which is holding your incision when you cough or sneeze. The reason why this is important is that when you cough or sneeze, there is internal pressure that is pushing at your incision, and we want to keep your incision as secure as possible. So doing this is going to help prevent anything from opening up and will be more comfortable as well. Another great way to secure your incision is by using an abdominal binder, which is linked through my products page. And what it does is provide that security and comfortable tightness that keeps the incision braced and helps you feel like you are a bit more protected. The abdominal binder might not be super comfortable to wear all the time. It might be too restrictive when you're trying to sit down, but when you're moving around or going for a walk as you feel ready, the binder can provide a lot of support. But with or without the binder, you should be bracing your incision each time you are sneezing, coughing, even laughing, or going poop. Because of the sensitivity of the incision, holding and breastfeeding your baby might be more challenging at first. I want to encourage you to have someone help you as much as you can. Instead of you picking up baby out of the bassinet or swing, let your partner or another support person do that for you. Try various positions while you're breastfeeding, like the football hold or side lying, and let people bring you food or help you get to the bathroom, and really give yourself the time and space to let yourself yourself heal as a postpartum mama and as a mama who has just undergone abdominal surgery. You should not be lifting and carrying anything heavy, and in the beginning, even your baby can be too heavy for you to pick up comfortably. So having your partner bring the baby to you and help you get positioned to nurse is going to be so helpful and aid in that healing process. Now, if at any point during your recovery your incision becomes really hot and red, if you're seeing yellowish discharge, pus, or blood come out of it, or if you spike a fever, these are all reasons to call your care provider right away. Along with observing your incision for proper healing, you want to make sure your postpartum bleeding is under control as well. So if you're passing golf ball sized clots or larger really regularly, or you're gushing blood and passing golf ball sized clots at the same time, and you're soaking through a pad within an hour, these are all reasons to reach out to your care provider or call an advice line right away. If you notice any foul smelling discharge, again, if you spike a fever, or if you have any sharp pains, especially in your leg, along with redness and swelling, those are reasons to get in touch with your doctor or advice line right away. Postpartum healing takes time, mama, especially if you've experienced a cesarean birth. Take all the time that you need to recover your physical health and even emotional health as you process through your birth experience if a C-section wasn't a part of your plan. It takes so much trust and strength to surrender your own plans, your own desires, as well as yourself and your baby into the hands of care providers who you may not have ever even met before for the health and safety of you and your baby. So I want to encourage you to feel whatever emotions you need to as you're healing both physically and emotionally. And remember that you are a strong mama who is incredibly made and done a beautiful thing for your baby in birthing them. And as you navigate the healing process after a cesarean birth, I hope that you're able to use all of the information that you've learned in this session and all the tips and tricks that you learn on your own as you experience your own personal journey to experience a happier, healthier, and easier postpartum period. Mama, if you enjoyed that video, be sure to check out builttobirth.com, linked in the description below, if you want to see hours of easy to understand and foundational information like you've seen in this video through my full Built to Birth childbirth and postpartum course. If you are not ready to join quite yet, check out my free mini birth class to learn more crucial information on navigating birth and postpartum. So thanks for being with me in this video, and hopefully I'll be seeing you soon over on the Built to Birth online course.